This segment of Good Company was sponsored by Oral Design Cleveland.
Losing teeth, failing teeth, it can happen, and then there goes your smile. So how do you get your smile back? Dentist Dr. John Heimke joins us right now. The Oral Design Cleveland is where he is located. He's got an option here for you, and it's really something you have to consider. Dr. John, thank you so much for being here. We appreciate it.
It's a pleasure.
Yeah, thanks. Let's talk about this here, because when something does go wrong with our teeth, sometimes we just let it go.
Right.
And then it goes worse, and we go spiral down. The next thing you know, we need a brand new smile. We come to someone like you, and you can make that happen rather quickly.
Yes, we can.
Yeah.
Yeah, because teeth sometimes go on a terminal path and there's nothing else we can do. So we have to clean the slate. And when we do that, we have to create a beautiful smile. And we use dental implants to do that. But we want to make a smile look like that person's smile. So just like any custom designer, you know, an interior designer, fashion designer, an artist, plastic surgeon, aesthetic dentist, you know, we're creating something directly for a person. So we have to learn about them. I want to interview that person. I want to find out really what their essence is. And then I'm going to study their face and take all these characteristics and put it into that smile. So it's not somebody else's smile, it's just a better them.
Oral designer dentist would be the label on your door then.
Right.
Right.
And our oral design team of myself, Pinhas Adar in Atlanta, the master dental technician that actually, he takes my design. Think of me as a, like I said, a designer making a blueprint, a 2D blueprint, and then he'll translate that into a 3D model that is the teeth and also the gums. So with dental implants, not only do I have to create teeth, but we have to create the gums and the supporting structures for the lower third of the face. So there's a lot going on. So it's more than just like veneers and things like that, because we have a blank canvas, and so we got to put everything back together.
The good news is the canvas becomes blank. You know, you're not building off of something that's, well, that's the best we have to work with. You can start fresh.
Right.
Yeah.
And that's the best thing. The disease goes away, the teeth go away, and then in a matter of a few hours, the implants go in and you have a healing bridge that goes in. 90 days later, the bone melds with the implants, and then we make a prototype, work out all the details, aesthetics, function, all that, and then we go to the final zirconia hybrid bridge. It gets screwed in.
Wow. And you're going to take us on that journey right now.
Yeah, look at this patient here that's coming
let's take a
up.
look.
So this is Pinhas and myself. We were on the show a couple years ago. And this patient here, as you can see, had many challenges on his smile. His teeth were failing, and we created the blueprint.
Okay, all right, great. This is really cool to see.
Yeah,
right,
so this is just like a blueprint, like we'd make a blueprint for a house or something.
Right.
And then Pinhas takes my design and he fabricates the prototypes. He actually makes the ceramic. Here's an illustration. The teeth come out and then the implants go in. We work with the surgeon on this. We have an integrated oral design team. And then the prosthesis goes on. And obviously, like I said, a healing one, then a prototype to work out the details, and then the final, and it all kind of comes together.
What timeline are we looking at, doctor?
Actually, it's about a 6-month timeline, but never is the patient without teeth.
Look at that smile. It's
Yeah,
just
look at that. Look at that. This guy's amazing.
And that is permanent.
Yeah, that's permanent. Only we can take out the prosthesis.
Right, so. And then that's the way it should be.
Yeah,
you know,
yeah,
exactly
yeah,
right.
Yeah. So it's quite exciting. And these days, you don't have to put your teeth in a jar every night. You know, like grandma, unfortunately, or maybe an aunt and uncle. That, you know. So who wants to do that? Nobody wants.
This has got to be so fulfilling for you. What do you hear from your patients?
Oh, they're just ecstatic when they come in. They go, "I should have done this years ago." You know, patients that have dentures come in, and you know, we do this for them, and they're like, "Oh, I'm so glad I'm not putting my teeth in a jar every night."
No kidding.
You know, and they said food tastes the way it should. Their palate isn't covered, you know, and they can have those beautiful white teeth that they've always wanted.
Right. No matter what they've been through.
Exactly.
I think that's awesome.
Exactly.
Well, for more information, Oral Design Cleveland at 21851 Center Ridge Road, Suite 302. It's in Rocky River. You can give them a call at 888-255-3588 or 216-496-8132. Great website. Everyonelovesmysmile.com and dentalimplants.rockyriver.com. Thank you so much.
It's always a pleasure. Thank you.
We so appreciate it. Now let's find out what's happening, Holly.